My name is Heather Moore. I'm an RN at Harrisburg Hospital. I work at a cardiac interventional unit where we discharge patients after heart catheterizations every day. I'm here to talk to you today about the sites your doctor used to access your heart, the restrictions when you return home, the care of those sites, and when to call the doctor. The cardiologist may have used your wrist, your arm, or your groin for your procedure. This is where they entered to access your coronary arteries. On your wrist, it would have been your radial artery, your arm, your brachial, and in your groin, it would be your femoral artery. They access these arteries to stent one of your blockages in your heart. Here's a picture of what the stent would look like. It returns normal blood flow to the heart. This is to remedy any chest pain or angina or symptoms that you were experiencing. For restrictions, if they used your arm or your wrist, you don't want to lift anything over 3 to 5 pounds for 2 days. You also don't want to drive for 2 days, and you want to avoid any flexion or extension of your wrist for those same 2 days. Do not operate a lawnmower, motorcycle, chainsaw, or altering vehicle during that period as well. If it's your groin site, you want to avoid lifting more than 10 to 15 pounds for 3 to 5 days. If you're taking Coumadin, it could be for up to 2 weeks, so refer to your specific discharge instructions. No driving for 7 days. Also refer to your specific instructions. Sexual activity may be resumed with no restrictions other than not holding up your own weight, so you might want to use a bottom or sideline position. All of your sites may remain open to air. To care for them, you wash them with soap and water. No dressings are needed, and you don't want to use any lotions, powders, or creams around that area. I recommend putting a stack of fresh washcloths right outside your shower so that you can use a fresh one each day and wash that area first. You also want to make sure that it gets dry. No tub baths, swimming pools, or hot tubs for 1 week if they accessed your groin, and you don't want to submerge or put underwater a wrist or arm site for 3 days following the procedure. You want to call your doctor if you experience any lumps that are bigger than the size of a lima bean. The size of a lima bean is okay, but anything larger, you'd want to call your doctor. Any swelling or signs of infection, such as a fever over 101.5, pain, redness, or discharge from your puncture site. Also, if any numbness or tingling were to occur on your hands, your feet, you want to call the doctor. If your wrist site would bleed at home, you want to apply pressure right to the puncture site on your wrist and keep your arm up for 10 minutes. If the bleeding stops, you want to still keep it straight for 2 hours and call your doctor. If it's your groin site, you want to apply pressure and dial 911. The greatest risk is the first 24 hours. That's why you normally stay overnight at the hospital. It's a good idea to have someone with you the first 2 days at home. Do you have any questions?
Can I have an MRI after this?
You can have an MRI 8 weeks after you've had a stent placed.
Can I take aspirin with my Plavix?
Yes, that's a very good question. You can take aspirin and Plavix together for the prescribed time. Also, you may be prescribed Effiant or Ticlid or any other antiplatelet medications. They keep the platelets from sticking to the new stent until it has time to grow inside the artery.
Okay. Do I need to carry this paper around with me?
Yes, that's a card. They'll give you a temporary one like this when you're discharged, and you can keep it in your wallet. But they'll send you a more specific one. But it's great for any emergency medical people who have to treat you after, so that they know you have a stent.
All right. Thank you.
Yeah. Well, hopefully your symptoms have improved, and now you know how